thank you so much. It's such a wonderful opportunity to come and talk to you, especially on this, in this event. And I'm excited to share what we've been doing to get the center started up. I know there are a lot of questions about it. I'm just going to put this out there right now. I would love for this to be an informal chat with you all. Tobacco and nicotine is an issue that we all in some way have some experience with, whether it's personally or with people that we know, and there are a lot of questions out there about it. And so I would love to have a discussion. I've structured this talk just to be an introduction about our center and the initiative behind it, but I welcome the opportunity just to have a discussion amongst us about what we know and what you want to know about nicotine and cannabis and the intersection of what we're doing in the state of California and beyond in promoting health in our communities individually and across multiple levels. So as a background, this isn't working. Did it work? Yay! I have my PhD from the University of California, Davis. I'm basically a UC gal. I've been here since 1999. I did my doctoral work at Davis, and I did my postdoctoral work at the Center for Tobacco Control Research and Education at UCSF. And I came here in 2008 as a new assistant professor to help build this wonderful university. Before this talk, I had to walk around this building because this was not here like a blink of ago, right? And it was just, it's amazing to see this campus develop. But I have to say that, the story of the center and work on nicotine and cannabis really is this campus-wide effort that has lasted for 10 years. And I say this because many of us came to UC Merced to build something and to build this community in the San Joaquin Valley. We all believed in coming to this area to do something and help the area lift itself out. So remember 10 years ago, Merced was one of the hardest hit economically. And we were at the height of a recession. There were foreclosures everywhere. In fact, the New York Times did a piece on this was like the second highest rate of foreclosures in the country. And along with economic depression, what you see are increases in risk behaviors, depression, mental health issues in general. And so it was a time where you saw faculty come to UC Merced to figure out what can we do to create a university, to do something different, to create a new academic model, and a model based on being a part of the community to make it better, right, to uplift us. And so one of the things that many of us noticed when we got here is that this is a region full of potential, of amazing positivity at the height of a recession, and there are many reasons to be believed, but it had an amazing strength that people didn't know about, that people didn't understand, that we didn't hear, and all you heard about in California was how great we were as a state, and look how low tobacco use is. We are so healthy. Everyone in California is a vegetarian. Look how great we are. And yet you see in the San Joaquin Valley, things are not as bright as we make it out to be on the coast. So one of the prime examples from 10 years ago of how stark this problem was, many of us wanted to conduct research about, well, where are the health issues in the San Joaquin Valley? And so what we tend to rely on are these big, large epidemiological data sets where you've got like tens of thousands of people responding to these surveys, and then we can get an estimate of where the disease is, how are people eating, are they eating healthy, are they not, are they smoking, are they using drugs? And for the state of California, we have these statistics at a pretty fine-tuned level, usually at least by the county level. Well, when we were looking at the data, if you were to come up with these statistics about what's going on in our communities, across towns in the San Joaquin Valley and the Sierra foothills, there's an asterisk right next to a lot of these statistics. And these asterisks basically say there are not enough people that we sample to actually get a good, accurate, idea of what's going on in these communities. So really that asterisk means we don't know what's going on, right? They're not statistically stable. And so many of us sat down and thought about this problem. So all these data that we are relying on to help us get a good picture of what's going on with the health status of our community, they're not good data. We don't know what's going on in our communities. We don't know the extent of these health problems. We don't know the extent to which people believe misperceptions about tobacco and cannabis because we don't have accurate tools and survey methodology to reach the communities of the San Joaquin Valley. So for the past 10 years, my colleagues and I have been working really hard to create an initiative to bring resources into the San Joaquin Valley to be able to pull the community together, to shed a light on what's going on in our area, and to create programs and interventions and studies that are homegrown here in this area, so that we know that problems that we have here, the solutions that we've come up with in the coast or nationwide may not be applicable because we are special. We are unique in the San Joaquin Valley. And the things that we learn here and the ways that we go about doing these prevention, intervention efforts should be thought of as a community partnership. Things that are grown here, applied here, and grown and developed here. So for the past 10 years we've been working, and it's culminated into the Nicotine and Cannabis Policy Center at UC Merced. So at this point I'd like to step back because yes, we have a problem in the San Joaquin Valley, but it's so funny, when I give this talk or versions of this talk, to other people, they're like, wait, you're from California. There is no tobacco problem, right? Like nobody smokes. And, tobacco researchers like to joke, wow, if we're really successful, we're gonna be out of jobs, right? Like we have nothing to study. But the truth is we are really so far from, an end game. We don't have this, we still have a problem, and we need to come up with a better solution. And the reality is that tobacco is still the leading cause of preventable death in our country. Almost 500,000 people die due to smoking-related diseases every single year. So 1 in 5 deaths is due to tobacco. And if you think about 1,300 people die every single day because of tobacco. If you were to add up all of the other preventable deaths, like car accidents, drug use, tobacco use dwarfs all those numbers put together. And someone had recently asked me, well, what about obesity? It is still a fraction of what tobacco causes. It's not just death. Death is a very weighty outcome. But if you're gonna think about, economically, right, money-wise, because, sometimes money speaks louder, right? Smoking costs our economy $300 billion every single year. And that cost is because people get sick from smoking. And so we spend an incredible amount of money to deal with the diseases caused by tobacco. And it's not just treating the diseases from tobacco. When people get sick, they can't work. And our economy doesn't function, efficiently. And so we lose all this productivity from people who could be working and producing in society, but they can't because they have heart disease, cardiovascular disease, lung disease, cancer, and immune system dysfunction, right? Getting colds, just little things like that cost our economy and cost us as a society. It's also an issue with youth. So most smokers start before the age of 21. And we now know, looking at previously secret tobacco industry documents, this is an industry that has spent hundreds of millions of dollars targeting young people. And something to keep in mind is that our brains continue to develop until we're 25. And our decision-making process really doesn't mature until we are young adults. And if you have an industry that is targeting youth, when they're not, when they haven't developed the full capacity to make informed decisions in their best interest, we're stacking the deck against us as a society in creating a healthy society in many ways. And so, people like to argue, well, smoking, that's a decision that people have made, and let them make their own life decisions. If it was a rational decision, we wouldn't see the level of regret that smokers have in many cases. 80% of smokers regret ever picking up a cigarette. 68% want to quit. They don't want to be smokers anymore. And yet what we know through, research study after research study, addiction is incredibly powerful. How do you fight something that tells every cell of your body that it needs this substance in it and you need to smoke? How do you get people to empower themselves to be able to break that tie? It takes a lot of research, and it takes a lot of community support to be able to do so. So nationally, it is still an issue. At home, California is an international leader in tobacco control. And what I mean by tobacco control are, widespread efforts to reduce smoking and eliminate smoking-related diseases. California is cutting edge. Countries model their programs after what California did. California was one of the first to promote smoke-free restaurants. Many of you are too young for this, but back in the day, you would go and try to get a table and they ask you, smoking or non, right? And just 30 years ago, this idea that restaurants would be smoke-free was it was groundbreaking. It was mind-shattering to think that restaurants would be smoke-free. And California was a leader in this initiative. And in fact, back in the day, when many of my colleagues were promoting and using science to say this is an important issue and it is scientifically based policy, right? There's evidence to demonstrate how important this is and how effective this could be. There were protests in the streets, right? There were chefs and restaurateurs who were saying, this is gonna crash the economy. This is a terrible decision. No one is gonna wanna eat if there's no smoking allowed in restaurants, right? And now we know, right, that smoking totally kills your taste buds, that people are actually enjoying this experience of being able to eat with family members without having smoke infiltrate, your experience. And so we, as Californians, should be proud of the things that we have done to push the boundaries of tobacco control. And you see a proliferation of tobacco control efforts from California all the way across the state, or across the nation, and across other countries as well. But the sad part is that when you look at us as an area in the San Joaquin Valley, we are totally lagging behind. The state prevalence is 12%. 12% of Californians smoke. But in our communities, that prevalence goes from anywhere between 16 and 20%, right? And it's on par with many of the high smoking states in the country, like Alabama and Georgia, where we think of those states as being tobacco states, while the San Joaquin Valley has prevalence rates akin to those tobacco states. And for me, that's unacceptable in a state that has pioneered tobacco control to have a third of this state be behind in tobacco control is something that we can do something about and we should be up in arms about. What about cannabis, right? And so I get this question all the time. Well, you're a tobacco control researcher, and so where's this cannabis coming from? Let's face it, right? The nature of cannabis policy has changed drastically in the past years. We blinked and policies across the nation have changed. And in fact, people ask me all the time, oh, you're the director of the NCPC, so what's the law about cannabis, in our state? Is it legal, is it not? So it has drastically changed. It is, recreational cannabis has been legalized in California, and we see propositions all across the nation to legalize it. However, it is still a restrictive substance because many localities set their own policies about cannabis, right? So at the state level, it is recreationally allowed, but each local ordinance has determined whether dispensaries can exist there, how restrictive it could be. And so there are a lot of mixed messages as to what cannabis control really looks like in any of these particular regions. And something that we are all interested in is that, so we've got all of these policies that are coming down the pipeline, and the landscape has changed drastically. What are the downstream effects on people's health? Right? There's a lot of ideas about cannabis, and it's because there are medicinal uses of cannabis. Like there's medical marijuana, and there are some benefits for certain populations. And yet, there is a question as to, well, where does that benefit extend? So is it safer than cigarettes? Can I use it as an alternative? Is it totally safe? We are hearing people say, cannabis, smoking marijuana is fine, it's natural, it's a plant. Well, so is tobacco, right? We have heard people, I've had physicians come and talk to me saying, I treat adolescents and eating disorders, and I have parents who are supplying their young kids with marijuana because we hear it's supposed to lessen their anxiety and help with their eating disorder. And that perception to me as a health psychologist is very dangerous. Where is the empirical support for that approach? Where is the harm? And what kind of messages are we sending to our youth that we can self-medicate for, disorders that really need a multi-pronged approach to address? Are we putting a Band-Aid on something like eating disorders in youth by supplying marijuana when really we need to think about multi-level strategies of supporting the youth with a disorder? On a more public health level, these questions have brought up, well, what do people think about cannabis and marijuana use? What do they know? And the way that these substances are being used also vary and also determine how dangerous it could be. So even with something like tobacco, smoking cigarettes has gone down, but there's something coming up, and it's coming up really fast, and it's e-cigarettes, right? And with e-cigarettes, you also see vaping of marijuana use. And so we've got all these different ways in which cannabis and nicotine are being consumed. And right now there is very little data on how safe any of these products are. And in fact, of the data that we have, we know that it's not as safe as we thought. Right? And that even with e-cigarettes and vaping, you are consuming things that you don't know that you're consuming, like all these flavors that e-cigarettes and I guess any of these marijuana liquid pods are coming in, with cherry flavor, cheese, I heard cheesecake, popcorn, like buttered popcorn, which, but these things are being consumed, and we think about, cannabis and nicotine as being the active ingredient, and that's what we're worried about. All those flavors are chemicals that are being consumed at a temperature that makes it unstable. And you are consuming that in your body. We don't know what the long-term effects of any of those things are. And so policies that are being developed to try to control some of these health effects are incredibly important. But these policies can't be effective or even be developed without having good data on the ground to understand what people are thinking, how these substances are being used, and how much support there is at the community level to help these policies become effective. Last, the other reason why we are really interested in cannabis is that with cannabis, there is a very high probability that there is a relationship between cannabis use and tobacco use. And preliminary data suggesting that back in the day, we used to think of tobacco as being the gateway, right? Oh, cigarettes are going to open the doors, and all of a sudden people are going to start using marijuana and opioids and all these things. What we're now starting to realize is that it may actually go the other way, that cannabis use is actually starting to open the door for tobacco use. And so what we thought we were making great strides in curbing tobacco use and smoking-related diseases. And with the evolution of cannabis policies and mixed messages about the safety of cannabis, are we now inadvertently opening the door for an increase in tobacco use, an uptick in tobacco-related diseases? We don't know. And so part of what we are thinking about actively as researchers is this intersection. What is that intersection, and what should we be prepared for? Because the worst thing would be is if we're behind the ball on this one, right? If things evolve and we are left standing flat-footed on many of these issues. So is there a control issue? Absolutely. What we've learned in the past 10 years in the San Joaquin Valley is that there's a severe lack of infrastructure to support these tobacco control policies at the state level. We really don't know whether any of the policies that we have on the books are being effectively enforced. And a lot of the policies and research that we know that have been developed on the coast, we don't know if they're being implemented in our own communities. For example, we know that advertising and bystander advertising of cigarettes, like you drive down any of the streets, and if you pass a gas station, you will see signs for discounts on cigarettes, right? Gas station, 7-Eleven. Those are pieces of advertising that influence people's attitudes and perceptions of cigarettes. We know that as children are going to school, the more they see and pass any of these advertisements, the more susceptible they are for smoking. And so there has been a huge push in urban areas to limit those types of advertising. How much of an effort is there in the San Joaquin Valley? How close are these advertisements to our elementary schools and middle schools? Where are these advertisements as children are walking in their neighborhoods to get to these schools? And these are questions that we actually don't have answers for because we don't have the infrastructure yet to go and find these answers. And they are absolutely necessary, right? Critically important to understand so that we know where enforcement should be. The key point and one of the basic messages of our grant has been we need more data, right? We need data for our particular area because lawmakers need to understand that the San Joaquin Valley is an incredibly diverse, rich area. And that some of the things that we think about and have developed on the coast may not work for us because we are incredibly ethnically diverse, we are socioeconomically diverse, we have representations across the political and philosophical spectrum. And so many of the things that that have been developed in LA, San Diego, and San Francisco, right? They're not developed for us here in the Valley. And the other issue is that, well, then they say, go study it, right? Well, traditionally, what has happened in the past is that you have researchers who have come in to the Valley and said, listen, we are here. We are going to help you. And these are the things that you need to do. So here, why don't we take, some samples from you? Take the survey, right? And we'll be back. And you don't hear from them again. And you don't know what they found. and you don't know what that data was used for. And they don't come back, unless they need something. So imagine year after year of communities opening the door for organizations to come and help their communities through science, only to be, left hanging there waiting for the results of these groundbreaking scientific results that they never hear about. And let's be honest, science cannot progress without people, right? And so what scientists have have inadvertently, but honestly have done, is alienated people who are absolutely integral to science in and of itself. And so what we had been facing was a lot of reluctance and mistrust from the community for science, of all these scientists who are coming in and we're gonna help you. Well, who are you to help us? And where are you gonna go? Where did you come from? And will we ever hear from you again? And so how we will help as a center, one of the foundational missions of the NCPC is that we are a part of the community. We are here, we've grown from here, we started as a seed from 10 years ago. And as we were writing this grant, and I actually have many students in this room who saw me at the height of writing this grant, and thank you for bearing with me, everyone, was doing these tours across San Joaquin Valley, meeting with people in public health departments, different organizations, explaining, look, we have been here. A part of the charge of UC Merced is to be a part of the community and to build the infrastructure and capacity for health in the San Joaquin Valley. And so what I heard over and over and over again as I was meeting with all these different organizations and public health entities was that finally, right, it is about time that we as a community, right, come together and make policymakers hear how great we are, but how much we need, and how we need to get organized and band together, right? And do this as a partnership, and this is the key point. This is not academia coming in and saying, here are the answers. This is a model where we say, we are part of the community. Let's identify what the key issues are. Let's talk about how we, as a community, as partners, will come up with strategies to convince our policymakers that we need infrastructure, help, and here are ways that we can do it. So we are here to establish grassroots support for tobacco and cannabis control. We're going to look at smoke-free indoor air policies. One of the big things here are like multi-unit housing. People think, well, if my neighbor smokes, at least if we close our windows, it's fine. No, you share central, air circulations. What you smell here, if you smell it, you are consuming it, right? And so what are the policies in the San Joaquin Valley? We want to monitor tobacco control and cannabis control strategies across, the region. One thing that came out of writing this grant was that there are other small adjoining communities that wanted help and wanted to be a part of this movement. And so we have the Sierra Foothill communities coming in and say, hey, don't forget about us. Right? We have rural regions almost all the way over to Santa Barbara saying, hey, us too, right? Because there hasn't been an organizing effort to document where these tobacco control policies are going and how we can band together to make it stronger. We are here to support short-term and long-term research. We have a flagship study that if we have time, I'll describe. But we're also here for short-term research as well. Things are changing and they're changing very quickly. And so what we're here also to do is to respond very quickly to things that might pop up. There might be things coming up in a city, at a city level, where they're talking about banning flavored products. Well, we are here to help, study the effects of that kind of policy and whether that kind of strategy might be applicable in different regions. And so we're geared to be fast moving, but also think long term and help inform policymakers for a long-term endgame strategy for tobacco control. And the fourth thing is that we want to be a visible and established, stable presence in the San Joaquin Valley. I can't stress this enough. We are a part of the community, and we are here as a resource so that we are not going away, and that we hopefully will be someone that everyone can rely on to think about these policy changes and developments that come across the board, right? And that we will be that continual presence and resource for different organizations in the San Joaquin Valley. So we are focusing on 11 counties in the San Joaquin Valley, the 8 counties of the San Joaquin Valley and 3 foothill counties. Basically, all 4 million people in this area are people that we hope to reach at some point. Our region includes some of the poorest regions in California. And our hope, long-term strategy, what we're hoping is that we're going to reduce this 16 to 20% prevalence rate across the San Joaquin Valley and Foothill Mountains. We're hoping to lower that, right? And help produce evidence for an end game, right? A final solution for the tobacco problem. The NCPC, the way that we're structured is that we have an administrative core to help support different endeavors in the center, but our main active entities in the center are our research core, community core, rapid response research unit, and training core. Quickly, the research core is engaged in a long-term project across 4 years. And what we're hoping to do is address the main policy gaps in tobacco and cannabis control efforts in the region. And really it's to address the issue that we lack major data in this area. And the other part is that we are not utilizing one of the biggest strengths in the San Joaquin Valley, our youth. I mean, if we've learned in the past year, youth are powerful, right? Just with gun control, you saw after Parkland, right, how forceful and how quickly and how effectively youth can come together on issues that impact them. Well, the San Joaquin Valley is has one of the higher proportions compared to the other counties in youth. And we have youth that are bright, energetic, motivated. And who better could advocate for the future of California than the people who will be inheriting that future? And so what we're hoping to do is to mobilize youth and recognize that youth are effective agents of change. They are change in and of itself. They will make change. They will make change lasting. And if we can empower youth to do so, we can make huge progress in tobacco and cannabis control. Our youth in San Joaquin Valley are ethnically diverse, and they represent a host of different cultures. And in one sense, this isn't a way that, we have not done justice to the diversity of these communities. This is an opportunity where we can think of how youth, right, are developing. What cultural strengths do they bring? How can we harness that energy, right, and have them be advocates for their own communities? So what we're going to do in this region is that we're going to conduct a series of interviews and focus groups across these 11 counties. We're going to collect qualitative data. We are going to talk to pretty much anyone who is willing to talk to us. We are going to every community event that is humanly possible. If we could clone ourselves and like double, triple our efforts, we will totally do that, right? But we're going to get as much data and digest it and get it into the hands of our legislators so they can make better informed policies for our region. And the other goal that we have is that we are going to implement a youth empowerment curriculum. We're going to recruit young adults in all 11 communities across the ethnic communities that are in our region. And we're going to train them on how to do policy research, how to engage with the media, how do you get in touch with your local and state level and federal legislators? How do you digest all this into a policy brief? How do you write an op-ed piece, right? Or letters to your editor? And we're going to train them and get them in touch with policymakers so that they can present their work and be direct advocates for their community. And once they learn how to do this, what we're hoping is setting them on for a path to be advocates, but also to be peer mentors for their groups when they go back to their communities. The other aspect is the Rural Rapid Response Corps. This corps is set to monitor needs of our different communities. There are so many needs. All these public health departments and agencies and nonprofits have already come to us and said, this is an issue. Can you help us, right? And so with the resources that we have, we're set up to conduct what we call quick strike studies, right? Things that we could tackle in about a 6-month period. Can we go and find existing data? That's kind of hard. As I said, data does not exist, right, for us. But can we quickly go out and do flash polling in the community to be able to get at least an inkling of what's going on so that we could feed it back to public health departments and organizations to say, okay, so here's what's going on, and this might be the direction that we should be headed. And working with them to build capacity to disseminate this research to key stakeholders in our community. We have a community core where we have community-based organizations across different levels of government. We have the American Heart Association as our national level partner in this, where they have been a key advocate in state level tobacco control. They're the ones who have done incredible work on smoke-free laws across the country. They've partnered with us as well as Healthy House, which is a local community-based organization who basically, they are the authority of what's going on with people in our communities across the ethnically diverse communities that we have. And the way that we've set this up is that information and training will be going both ways. The American Heart Association has amazing experience at these big statewide campaigns. But local organizations are the ones that know what people are thinking and feeling and how things work here. And so the community core is a mechanism in which these two organizations will be training each other and sharing information to be more effective in reaching out to our community members and making sure that the community is a thread that is weaved across every aspect of our center and what we do. And last, we have a training core. A big part of our mission is to build capacity, right, of everybody interested in doing tobacco and cannabis control. And so we are here, this core is geared towards training emerging scientists, people who have really not thought about doing cannabis or tobacco research, but have amazing research that could be applied, right, in doing work that would inform tobacco and cannabis policy. We're here to support students who are thinking about doing policy and tobacco and cannabis policy research. but also community members who want to be engaged and be a part of this process, and inviting them and talking about, well, what are scientific methods? How can we do this? This is how, this is a scientific process. It's frustrating and slow sometimes, but this is what we can do at the end, and what we can do with the data and how we interpret the data. So, thanks to our funder, the Tobacco-Related Disease Research Program, we have 4 years to do all of this. People are like, aren't you so excited? I'm like, I am so excited, right? But it is a lot to do because the need is so high, But we are here to strengthen that foundation. And our long-term goal will be to build our community networks, right? To be self-sustaining. And for us as a region, as a community, to take control over the tobacco and cannabis issues in our communities, right? We can take control of this. We can have an impact. We can make a change. And through science and data and working together, we can actually do this. And we will continue to produce cutting-edge research that directly informs our policymakers, right? We want our policymakers to recognize our needs. And so we will produce this information so that they are better informed to help create legislation that is meaningful to us and will have a significant impact for the good of our health as a community. So I do want to thank our funder, the Tobacco-Related Disease Research Program, administered through the Office of the President, the San Joaquin Valley Public Health Consortium, who represents many of the public health departments in our valley. Assemblyperson Adam Gray, who gave us a lot of advice and was very happy to finally see some recognition of our area and the need that we have, and our partners and our university, and many of the towns that since news of this grant being funded and us starting as a center, all the towns that have written to us, we get handwritten letters from small communities saying, finally, thanks, and what can we do to help? And what that speaks to is that we as an area are awesome, right? We are awesome, we are strong, and this is an opportunity where we are ready to institute change for the better. So, thank you.